Hi, this is Dr. Scott Worden, the TOS guy from beautiful downtown Sunnyvale, California. Today, we have a great presentation that's aimed squarely at the patients who go through the challenges of the different forms and variations of TOS. But first, I want to say a word. Thank you to our audience, to all our supporters. We very easily crossed the 1,000 subscriber barrier, which is really great for us with a tiny little corner of the world that we're in. It's really helpful to get all this support. So we appreciate that. And it enables us to do a few new things that we couldn't do before. So thanks for your support. Anybody who hasn't subscribed, please click the subscribe button. And you can click the little bell next to it so that you'll get notices every time we have another one of our live streams. And during the talk, if you click the like button, that's a huge help to the algorithm that helps YouTube find us and push us higher up in the rankings. So when other patients search for thoracic outlet syndrome, they'll find us sooner. So thanks again to our supporters. Today, our talk features two of our past participators. We have Jake, the elite swimmer. I always put those words together. And if I hear somebody else mention elite swimmer, I always think of Jake. And he's got some great news for us. And then we have Ariana. You may remember meeting Ariana because her dad is a doc as well. And she's studying a very heavy scientific curriculum in school. And they both went through TOS. But they have very contrasting stories. So what I'd like to do is, ladies first, Ariana, why don't you share with us a little bit about your disease and your process?
Okay, so I first began showing symptoms of TOS when I was about 9 years old. I was a competitive figure skater, and at the time I'd fallen and broken my leg and was put on crutches for about 3.5 months. In that time, I started getting like on and off sensations of tingling, numbness down my arm, and then eventually one day it never went away. After years of going to different types of doctors and specialists, running MRI after ECG, like after everything, I didn't have any clear diagnosis. So when I went to college, I decided that I was going to stop and just kind of live my life and live with it as I was like kind of told that's how it was going to be. Until last year, my junior year, when I started getting stiffness in my hands and I lost like mobility and I was unable to like participate in school and like hang out with my friends and just any activities of like life. So then I met Dr. Worden through my dad, like he mentioned, and we began working together. And then I was officially diagnosed with thoracic outlet syndrome. And I got my ribs removed in the recent year, my left rib in March and my right rib in May. So now I'm just kind of going through the recovery process of that.
And your type of TOS is?
I My surgeon told me that he believed it was like a mixture of all three, so arterial, venous, and neurogenic, just caused by the small amount of space between my first rib and my second rib.
Jake, do you want to share your story in the similar broad picture with us, please?
Yeah, I'm in year 6 post recovery or post surgery and diagnosed with TOS. I was diagnosed with the veno-occlusive version of TOS in 2018. That was my junior year of high school. I've been a competitive swimmer since I was 5 years old, and it was the day after I committed to go swim in college. Um, I wasn't able to lift my arm above right here in my shoulder. My arm was twice the size of my left arm, and it was purple. So quickly realized that something was very, very wrong. So I went to the hospital, and they diagnosed me with blood clots in my subclavian and axillary veins. And it wasn't until I went to the surgeon the next morning that they told me that I had a type of thoracic outlet syndrome called Paget-Schroeder syndrome. And I was rushed into surgery the next morning where they broke up the clots. And then 2 weeks later, I had my first rib removed, and they went in underneath my armpit through the brachial plexus. And then 2 weeks later after that, I had another venoplasty done. And then 3 months later, I had my last venoplasty, and that was in October of 2018. And it's now January of 2023, and I'm still able to compete at a high level. I was an All-American in 2022, and it's been quite a journey. I don't really have issues when it comes to being outside of the water in my everyday life. I've learned kind of how to adjust things, but when I am in the water still, I do occasionally have issues and flare-ups, and so I still have to take very good care of my arm and the rest of my body so I can co- continue to compete at a high level.
Thank you. We're going to go more into detail about a lot of those features. Great explanation. Ariana, you didn't get a diagnosis for many years. How many years did it take to get a real diagnosis?
It was a little over 12 years
Oh,
before I was officially diagnosed with TOS.
and that's with a dad who's a medical professional trying to help.
Yeah, exactly. And going to extreme lengths. I just don't know if many people were aware of TOS at the time and in my age group at least, because I was 9, like I said. So it was very uncommon. So when TOS was like thrown out there, most physicians that I saw were like, "Oh my gosh, definitely not."
They
Um,
just they
yeah, so it
wouldn't
was
accept
definitely a
it.
struggle.
So you're
No, it
saying
wasn't
they
really
wouldn't go
thought.
read.
It was just
They just knew it couldn't be because of a gut feeling sort of thing.
yeah, that, and then I also struggled getting a diagnosis because my symptoms didn't really match like textbook TOS symptoms. Like I didn't have a blood clot. I didn't just the way that they even tested me. So it wasn't until I lost like feeling in my hands and like mobility issues that I was further tested and got the NeoVista testing.
What did you go through emotionally during 10 years of trying to figure this out?
Um, it was really hard emotionally. I think one of the hardest parts was trying to not show how I felt to like my friends or my family because my family were going through extreme lengths to try to help me. And being that my dad's a doctor and helps so many other people, like I could see like the sadness in his face when I spoke about it. So it kind of just made it seem worse. And then not being diagnosed and having doctors not believe that I was in pain because I was so young. They were like, maybe she wants out of sports or school, to being sent to neurologists to see if I was just like having phantom pains or making it up for like attention. So that was really difficult because it's really hard to explain to people something that they can't see. Um, but with like my new diagnosis now, like it definitely has changed things completely because like I've always known something was wrong and now I have it on paper that I was finally able to like get the help that I needed.
Do you see, probably a dumb question, do you ever see any of your old docs now that you have a diagnosis and successful treatment?
I still keep in contact with my physical therapist that
Uh,
I was working with starting at like 13, I believe. And a couple of the pain management doctors that have like stuck by my side because I've had a hard time having consistency with doctors because of my case being so untextbook. They would tell me it was too difficult.
do the docs respond now? Do they say, I've learned more about the disease? How do you think they've approached it?
Yes and no. I think it's like a mixture of feelings. Some have, and then I think others are more closed off to it just because of, I guess, how many times I would go in to see them and kind of just not wanting to like talk about being unaware of something, even though it is very like much more rare than people know and it's not as common.
But in fact, it's not rare. Having done some research on the incidence of this disease, there's no strong data, and we really don't know. This is coming from a person who's fairly well versed in the disease. But I can tell you our gut feeling is because we're at the center of this, we see lots of people like you two, but plenty others who show up with this disease. And I don't know if it's due to more competitive athletes nowadays, where people using devices more. When I was a kid, we didn't have laptops, and now we've got laptops and iPads and iPhones, and nobody has a good posture for any of them. So the important thing is that you survive this. You're probably going to be a stronger person the rest of your life. And now you want to do research in the medical field.
Yeah, definitely. I want to, once I graduate, potentially go into thoracic surgery and help people the way that I was helped, which was something that I'd never even considered before last year.
It'll be
But
great. We can use smart people like you. Now,
I'll do it.
Jake, you went through a completely different emotional background because it was so sudden and because
Mhm.
surgery was so fast, right? Do you want to share with us those first, let's say, couple of weeks around that before and after surgery?
Yeah, so let's see. This happened in early April of 2018. My symptoms first started showing about 5 days before I went into surgery. And it was one day in practice, I looked down at my hand and it was purple, and but it quickly went away, and I was like, okay, like there's something sort of wrong. But I kind of brushed it off as I was getting back into shape. I had just come back from a 2 week break after the end of my season. So I um I kind of brushed it off, and then on let's see, on Sunday I committed to swim at Indiana University. Um and that was a big deal. They're a top 5 program. And when I was taking my commitment picture, I noticed that I couldn't pop my elbows. For some reason, I'd always been able to pop my elbows, and I couldn't pop it, and my arm started to feel pretty tight. Once again, I kind of brushed it off as, "Oh, I'm just sore from getting back into shape." Not a big deal. I came into practice on Monday and figured out I couldn't lift because my shoulder was in a lot of pain. I went to practice that afternoon and couldn't really swim. We thought that I'd be okay. So I got out of practice. We did some treatment on it. I actually did like the athletic trainers. There's like a test you can do. The athletic trainers can do that can diagnose or like see if you have symptoms of TOS. And I actually tested positive for that. Now that I think about it, but it wasn't like there wasn't like anything severely wrong with me. We just thought I was pretty sore. Um, then I woke up Tuesday morning and I couldn't lift my arm above my shoulder. Um, I was in anatomy class with my athletic trainer actually, and I asked him, I was like, "Hey, like, is my arm supposed to look like this?" And he was like, "No." So he called my mom immediately, and I went over to the hospital. Um, I had an ultrasound done, and it showed that I had major blockages. And I can still picture it sitting in the cold, dark hospital room. And my dad was in the corner. And as some of you guys may know or may not know, my dad is a physician also. He's a cardiologist. And so he was sitting in the corner. And when they told me that I had blood clots, it was like I felt like my whole world was crashing. I immediately thought I was going to die. I remember going home that night and I laid in bed and I was so scared to go to sleep because I thought a clot would move and go into my heart and that my parents would come up in the morning and I wouldn't be awake. And so I didn't sleep that night. I was terrified. Um, I went downstairs in the morning and my parents told me, "Hey, we're going into surgery. You can't eat." I was starving. So I was not happy about that. Um, But so then I went and saw the surgeon. He cleared his schedule for the morning for me, and he was great. Dr. Fugit was amazing. And they went in and did a thrombectomy where they broke up the clots in my veins. And I was kind of oblivious to everything that was going on at this point. Um, but it wasn't until I had a nurse practitioner tell me that I would never swim again that that's kind of when reality set in. And I was like, "Oh crap, like, this is not good." Because swimming's my entire life. It's what I was about to go spend the next 4 to 5 years in college doing. Um, it had given me all these blessings throughout my life. I've been able to travel around the country, for it, and I thought it was all gone. That was everything I had known, everything I had ever done my entire life. So I was determined to prove her wrong. Um, and I went through the recovery process, and it was the hardest thing I've ever done in my entire life. I mean, there were days where I would wake up in the morning and my alarm would go off and I would throw my phone across the room and I would just scream into my pillow because of the amount of pain I was in. And I was severely depressed at the time. Like, I struggled every day to get up and to continue to move forward because I looked at myself before I had surgery and I was on top of the world. I was a pretty successful swimmer. Um, and then I would go to practice in my rehab and I wouldn't be able to do a fifth, even a tenth of what I could do. Um, and I mean, I struggled a lot. There were days, and I've been so blessed by my support system. There were days where I would get out of practice in an excruciating amount of pain, and I would go down to the training room, and my trainer he told me this afterwards, um, that he would look at me and realize that it was a terrible day for me, but he would always make sure that I was doing okay and always encourage me. And so I was very thankful to have that because if it wasn't people like him or my parents who were constantly supporting me, doing whatever they could to make sure that I was okay, I don't know that I personally could have gone through it. I don't know that I would have been strong enough to do that. Um, but I mean, I made it through it. Um, it was very hard, but it was a very rewarding process because I never really stopped pursuing my dream of continuing to swim.
Mhm.
I throughout the next 10 months when I was practicing, I completed maybe 30 full practices. And that was extremely frustrating. I mean, I kind of would go until my limit, and then the second that my arm would hurt, I'd be out of the water. And I mean, I would throw my equipment as soon as I get in the locker room and just scream because I was so frustrated because I couldn't understand why it was happening to me, why I couldn't get better, and if it ever would get better and if I'd ever get back to that point. Um, Fortunately, I was able to, and 10 months after my last or 10 months after my initial diagnosis and surgery, I won my first state championship, and then a month later, I won my first national championship. And my journey never stopped though, because I still to this day have issues when I'm swimming. I've had races in the past couple years where my arm has gone asleep in the middle of the race, and it's so frustrating, but I've learned throughout time how to manage it. And so emotionally, yes, I get very frustrated still, but I have learned to keep my highs low and my lows high. I think that's something that's very important because at first, when I was going through this, my lows were rock bottom and my highs were rock bottom. So it was a very difficult time period. I don't even think I never let my parents know how I was truly feeling deep down inside, and that's something that it hurts because, you know, I always wanted to put on a brave face that I was okay, that I was making it through it, that I was determined and whatnot, but there were so many days where I just wanted to give up. I just wanted to lay in bed. I didn't wanna wake up the next morning because of the pain mentally, the pain physically of going through this every day because I wanted to get better. And some days it felt like it was too much and that I wouldn't get better, and so there was no point in trying.
Your diagnosis came shortly before your surgery. About how long would you say it took from the diagnosis to get back to a pretty normal emotional life?
A pretty normal emotional life, I would say, oh, man, let's see, it was in April. I would say it took until probably December emotionally to kinda have my head on straight because I had a setback in October where I had my 4th procedure where I had my last venoplasty, and so, that was a low point because in August, I had gone to junior nationals and I had gone 7 best times, and I thought that I was back. I was
Mm, mm.
thrilled. I was elated. I was like, I'm back. I'm unstoppable. Like I can do this. And 2 months later, I was back in the hospital. So, um, emotionally, it took probably until December, January to kind of get my head on straight and kind of know, okay, I can do this. But
So
it was
really
a hard
almost a
time.
year to go through the
Yeah.
treatment. And Ariana, how about for you? How long would you say returning to emotional normalcy has taken?
I think that's honestly hard for me to answer because my story is very different in the sense that I don't remember what it felt like to not be in pain. So it was more of like my fears emotionally were I was in such horrible pain at that moment, and I knew the odds of my first rib resections, and especially for the length of my journey and how long I'd been struggling with it, I knew like the odds weren't really in my favor. So I was more petrified of getting the surgery and the off chance that I would end up worse off. Which, so my initial diagnosis was like the best day ever. I'll never forget. I went home to my friends at school, like crying. I was like, they didn't even know what I was talking about because I never talk about it. And I was like, oh my gosh, like I have a diagnosis. Like this is the best day ever. I scheduled surgery for 2 weeks. And then later that night, it was like, oh my God, like I've been waiting for this, but now I'm absolutely terrified of everything that can go wrong. So that was really hard. And I also got like really depressed and really afraid very quickly, I would say, after my diagnosis, to the point where like last year, especially with my pain I was in, I couldn't really tell if it was worth going through the surgery or just worth living with it and hoping that it wouldn't keep progressing. Um, so I think that I'm just starting honestly now to like get out of it and start to get better now that both of my surgeries are like mostly recovered. Um, but it's been the hardest thing of my entire life, not even just physically. I think it's constantly something I think about every single day and like have to move past because I still have like a hard time. Like I'll have like a good day, but even in those good days, I have like bad moments still. So it's more of a constant reminder to myself to like push past it and like know that I'm still in the healing process. Like it's gonna take time. And I'm doing everything I can do right now, which is all that's left. Um, and trying to be positive about it, and more so kind of for my family than for myself, because I don't think had it been just me without like my family's push, I probably wouldn't have done anything. I would have just left and never would have gone to the doctors. But I felt some kind of obligation, I guess, those that cared about me to try to take better care of myself because of the mental state that it put me in.
So we've talked a little bit about families, and both of you just coincidentally have medical professionals for dads. Ariana, first, try to share a little bit of how your family dealt with this as far as you understand their internal mechanisms.
Yeah. So, this has been very hard on my family, especially my dad, because he sees patients who have tons of different disorders or issues, and he's able to help them or at least help get them to a diagnosis. And then seeing me and bringing me to like so many different doctors and treatments, it was very hard to watch like how disheartening it was for him because I never really was seeing it as a failure. I was just like, oh, doctors told me that I wasn't going to get a diagnosis. Like, I'm doing this for you, going to the appointments for you, but nothing's going to come out of it. Um, I think that it emotionally has really um, put a damper on, I guess, our relationship as well, because I don't want to bring it up to my dad and upset him more, like when I'm in pain, because like at the time he didn't know how to help me, so it was easier to just kind of put on like a face and get through it. But now it's definitely getting a lot better. I'm still not very open about it, which is honestly why even like I kind of even struggle to like talk about it on these calls because I've never very really been open about it before with like really anyone in my life. Um, but I'm working on it, and it's getting a lot better, and everyone's kind of a lot happier. to be out of the medical mess.
But your family being very involved was helpful in the long run, right?
Yes, it was. Well, my dad's a chiropractor, so initially when we started to see doctors, he thought TOS right away and it would be brought up. But because he didn't go to med school and didn't specialize in
Mm.
something, everyone kind of like wrote him off and they're like, you can go in the waiting room. Like if you have like you guys can talk about it later. Um, so it was kind of like the best feeling for me to like watch him be right.
That's
That was
sad.
great.
That's just sad.
So it definitely helped kind of push things towards the right direction, but I wish people listened to him more.
I could share a funny story. When I was managing an imaging center, we had a patient come in for a CAT scan of the neck. And this happens occasionally. A patient will have eaten fish the night before and they'll feel like they can't swallow. They're worried that a fish bone is stuck somewhere in the soft tissues of the throat. And it happens. But this patient had gone on Google and searched it up, and they brought in a paper they wanted to make sure I looked at before we did the CAT scan because it was describing how CAT scan would show different types of fish bone, like a cod fish bone from a different type of fish bone. And part of me wanted to say to the patient, it doesn't matter. There's a fish bone or there isn't. This is really easy. And no surgeon is going to say, let me get my cod rib pliers out. You know, it's the same issue. But you know what? Trying to be a reasonable person, you don't do that with patients. I reassured him, of course. I explained it very briefly. I said, that's really amazing. I've never seen this paper. But it doesn't matter. We're going to find it if it's there. We're going to help you. So it's troubling to me, especially having some experience in the TOS field, hearing from lots of patients and lots of doctors. It's a little disappointing that you would have doctors who would not at least say to your dad, okay, I'll look into it. Doesn't take that long
Yeah.
to listen. So that's unfortunate. And your length of diagnosis, unfortunately, was affected. And you live in a, major metro area in the country, and there were doctors there not
Yeah.
really doing their best. I say this because we know many of our patients have had to struggle with this. But I will say that from when I started doing this probably almost 25 years ago, it's gotten much better. Awareness is much better thanks to people like you. We appreciate you sharing your stories because it really hits an emotional vibe with people. They can feel it and they can say, that's me. That's me. I understand that. So, Jake, now your dad is a cardiologist, very
Mhm.
practiced, very well established, very knowledgeable. He has his own YouTube channel and he talks about important things to people. How did he feel dealing with this? He was trying not to be too involved because as a doctor, I know myself when my kids get sick, you don't want to make a bad judgment. How did your dad deal with this?
Yeah. So funny thing is, so I was diagnosed on Tuesday night. On Tuesday morning, when I had woken up, I said, "Hey, Dad, like I normally I don't talk about pain with my parents because as a swimmer, it's common to have a certain amount of pain in my body every single day." So I like would never really say like, "Oh man, like my shoulder hurts or my foot hurts," because like it's just the way of the business. Um, so I asked him to look at it and I was like, "Hey, like I'm in a lot of pain. Can you look at this?" And he looked at it and he was like, like let's take a wait and see approach. Well, we waited about 6 hours and I was in the hospital. But for him, I think the biggest thing that he did for me is I like the moment that they came into the hospital room and said, "Hey, like you have blood clots." He was there for me as a dad instead of there as a doctor. And I think for me, that was the biggest thing I needed because like he could have very well gone into doctor mode and been like, we're gonna do this, 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 and this. But he found an excellent balance of doing that. He
Mm.
was able to explain everything that was going on, but at the same time, he was like, "Hey, like we're gonna get through this, and we're gonna do it together." So for me, that was the biggest thing. Um, and then like my mom's a nurse, and so having both of them around me on a daily basis was great. Um, My dad was very much concerned for the long term, so he didn't care if I swam or not. He just wanted me to be healthy. And, even to this day, he's like, if I ever have like a flare up in practice or whatnot, he's like, "Hey man, like, you can be done if you want. You've accomplished a lot. I just want to make sure that you're okay 10 years down the road and you're not going to make things worse." So he was very good at keeping me focused on the long term. And I would say my mom was very good at keeping me focused on the short term. So I had a very good balance.
Mm,
Um, and, I mean, they were great for me. They knew when to push me, they knew when to
mhm,
back off. Um, and it's been great having a father as knowledgeable as him because sometimes I don't understand what's going on with my body, and he was able to explain it. Now, when we had the initial diagnosis of TOS, he didn't know much about it.
mm,
We searched for literature on it, and there was not a lot, especially amongst athletes. And that's where we came up with the idea to create my own website, which is
right.
helpforthoracikoutlet.org, where we kind of document my story and my journey through mostly the first year post surgery. But even now to this day, we still do check ins and updates on how things are going just to help other people out there because there's not a lot of literature about it. So that was hard, but I mean, he spent the entire night with my mom, that first night, just researching anything possible it could be. Um, and that was great because he knew where to look. Um, he knew the right doctor to look for. And it's funny now that my surgeon, Dr. Fugit, after um, after being my surgeon and going through all those procedures, got hired by my dad's group. So it was kind of like a tryout
Mm.
for him. But it was great to have him there, and he was great as both a physician, but most importantly as a father.
Hey, again, your website's got a great video on it. You want to repeat for our viewers the website?
Yeah, so the website is helpforthoracikoutlet.org. If you go on there, I think I have 4 or 5 videos on there. There's the main documentary, and then a couple. I have an interview or two on there with other patients around the country, also.
Well, that's great. I had a few episodes with my own kids going to doctors. I'll just share one. One of my kids, when very young, got a very serious infection and had to get some heavy duty antibiotic treatment. And there was nothing we could do except sit in the hospital room and hope that things would be okay. And so I spent my time reading. And again, like your dad, I tried to figure out something about this and I veered off into the pathway of, a lot of people talking about gut bacteria now and how much they affect our lives. And there was a professor emeritus at UCLA who wrote a fascinating paper with some connection between the gut flora changing because of antibiotic use and autism, which is autism is a hand grenade for a lot of physicians, especially pediatricians. Many of our viewers may be familiar with the fact there was a British doctor a couple decades ago who said vaccinations were tied to autism, which has turned out not to be valid. But anyway, it's a serious disease. It affects people's lives very significantly. And so there's a lot of emotional attachment to it. And so I asked our pediatrician after my child had gotten all this antibiotic treatment, I asked about stuff that could help repopulate the gut flora, healthy things. There's all this probiotics, prebiotics. And the pediatrician just yelled at me, just out loud yelled and lectured me that we shouldn't use Dr. Google. And I bit my tongue and I just said, well, let me send you a link to one paper. It's a very reputable guy and it's a peer reviewed paper. So it's kind of it's hard to be a parent and a doctor. I'll say that. So, Jake, let's go start with you. What's your future now? You have some great news to share, hopefully, with people who have been following. And tell us what your future is and what you want to do.
Yeah, so I'm currently in my last semester. Well, post-grad semester. I graduated in December from the University of Alabama, and now I'm in the middle of my season, so I'm still taking classes here. For my season, we have SEC championships in 4 weeks. So I'll be finishing up this semester here at Alabama, and then in July, I got accepted and will be attending the University of Tennessee Health Science Center College of Dentistry. So I'll be starting dental school there. I'm very excited about that.
Awesome.
It's going to be very hard, but I'm very excited to be able to work in the healthcare world and help bring beautiful smiles to this world.
That's great. Ariana, why don't you share with us where you are now and what your maybe short and long-term plans are?
So right now I'm finishing my undergrad, my last year of school at University of Florida. I'm studying science as well. My plan is to go to PA school in the future. Right now I'm working in research, and then I'm actually really excited because this summer I'm actually going to be going home and shadowing the surgeon, Dr. Ignacio Saris, who actually performed both of my first rib resections. So I'm going to go and watch him do the exact same surgery on other people and try to learn as much from him. And then take a year off, kind of travel a little bit while also taking classes and working as a medical assistant to get hours before applying to PA school.
Awesome again. And your doc, if you want to repeat his name and where he's located, we should give him a little shout out for doing such a great job.
Yeah, he was amazing. His name is Ignacio Saris. He's located in Holy Name Hospital in Teaneck, New Jersey. He was actually a family friend who I had an issue with my original surgeon pop up like 3 days before I was supposed to get the surgery done. So we were kind of scrambling and wondering like how I was going to go through with the surgery. And Dr. Zari stepped in and he was like, "Oh my gosh, like let me do it." So he was kind of the biggest blessing that has like ever happened to me. And now I'm really excited to be learning from him.
So he's doing more of them now, or has he just always been doing
Yes,
them?
he's always been
Mhm.
doing them. I was kind of nervous because I was so comfortable with the surgeon that I had originally planned, and I didn't really know Dr. Zaris. So my parents had me watch like old YouTube videos of him performing these surgeries, and spoke to him a couple times on his different approaches and his techniques, and just kind of like racked his brain because I also wanted to know what was going on.
Mhm.
But he's great. So I definitely am excited to be going through with that.
That's great that you get to observe these surgeries now. It's going to change your whole viewpoint.
Definitely a different experience. Some of my friends were like asking me if I even wanted to do that because they're like, I would never want to see something that happened to me. But I'm just like very curious, and not enough people, um, not enough people go into thoracic outlet syndrome in general. So
That's so true.
can't hurt to add one more.
That's right. We definitely follow you there. So I wanted to thank you both for sharing and for the time. I know this is not the first time you've done it. I'd like to say that we receive plenty of compliments, plenty of thanks from many people from all corners of the country that you guys did this. So thank you. It's really good for
Thank
other
you.
patients out there. And I bet you it makes it different. The experience for other patients will be different either now or in the future, thanks to some of what you're doing. Jake, dental school, great accomplishment. That's so cool. I don't know how
Thank
much
you.
work you'll do with TOS patients in the future, though. It'd be great if you could, because
um,
you know it.
I plan on continuing to still be an advocate for TOS. That's something that's never going to stop.
That's great. I know you will. So, folks who are who are watching us, I hope our two wonderful young people here in the prime of life, I hope they're sharing with you has been helpful in terms of understanding the variability that many patients can go through. There are physical challenges, of course. There are emotional challenges. There are just mechanistic challenges to get to see a doctor who's willing to read about this disease if he or she doesn't know it, or to get you to a specialist. I'll remind you that our website is tosmri.com. You can learn a lot also on a sister channel, toseducation.org. On our channel, our website, tosmri.com, you can contact us. There's a big button on the webpage just says contact us. My staff will help you. We give lots of advice for people to connect with TOS specialists to understand where you might be in the process and get you moving forward so that you can get an answer, yes or no. And then toseducation.org has a bunch of videos and learning tools. So we are advocates for TOS. We want to remind you, please subscribe to our channel if you haven't already, and get your friends and family to do so too. Every bit forward helps us spread the word for future patients. If you have questions and want to reach out to either of our young people today, please contact us and we're glad to hook you up. So thanks for now. 2 weeks from now, we'll have a similar live stream with myself and Dr. Art Jenkins discussing, again, some comparison and contrasting of some of the modern literature, what's latest in the literature about TOS. So Jake, thanks and continued success. And Ariana, thanks and continued success. And both of you keep your parents in line. They're doing a good job. And we'll say goodbye for now. Thank you.
Thank you.